Quality and safety and measuring outcomes via outcome research. I'm going to cover some basics related to quality kind of as quickly as I can so that if anybody needs to listen to this after the fact, you'll have this as a supplement to our class today. There are numerous definitions that you want to make yourself somewhat aware of, and we'll try to discuss most of these as we go along, but just so that those are all up front, and if you're trying to study to prepare for testing on quality subjects or on outcomes research, these are several of the key things that you need to be aware of. So there's like 2 or 3 slides here, but I'll just kind of click through those, many of which we're going to hit and define a little bit as we go through, so I won't restate that here. So let's discuss a little bit about healthcare quality in the 21st century. In industry, in the United States, and I mean that by many businesses and factories and industries that produced lots of goods into our economy, have often been driven by models related to quality of production of those goods, whatever they might be. And in industries, in probably starting around the middle part of the 20th century, we began to see quite a bit of adaptation in healthcare of some of the models that had been used in industries. And I'll talk a little bit about some of the major theorists that were involved with that transition. Also, now in the 21st century, beyond adaptation, many healthcare organizations have really put these models into effect, driven the changes that needed to be done, and really begin to see ongoing improvements in their quality of the care and services that they have provided. There also has been a change in mindset to where healthcare organizations have been held accountable to be obliged to provide more evidence-based and consumer and family-centered care. And so the stakes are much higher in terms of what the expectations are for care provision. We have had national demonstration projects that deal with improving quality in health care. We know that health care is very expensive, but does not always match the quality in terms of measures with other countries. There's also an Institute of Healthcare Improvement that was put in place. And then we have lots of different agencies, reports, different things that have come out that have really made the expectation clear. Primarily with hospitals, the Joint Commission has really focused strongly on, beginning in about the early 1990s, on the adoption of what we call a continuous quality improvement model in hospitals, which is CQI, or you may also hear people refer to that as total quality management, and we'll discuss a little bit more about those. And then the IOM, or the Institute of Medicine, has provided some reports that have driven a lot of the focus for how we go about doing improvements in quality in healthcare. So, tenets in terms of healthcare quality: there is the belief, if you really espouse to do quality management properly, that processes and systems are the problems, not the people. So, we've talked about that in terms of having a culture of a just culture where we don't blame the individuals when errors occur. And so if you really are going to work on healthcare quality in your organization, you really have to then drill down not into individual performance all the time, but drill down when there are quality problems and look at what is the process, how many steps are in the process. Is there a step in the process that's really causing the problem? Is there a bigger system problem besides just what happens at the bedside that's making this process problematic because of external influences? But the focus in these kinds of investigations, and you all will be doing one shortly in class, is to really look at what are those systems and processes. Another key element in healthcare quality programs is standardization of your process, meaning that whatever that process is, you really refine that to where it is very, very clear cut what is expected every single time, and that information is really shared about the work and with the people so that everybody is clearly aware of all the standardization to make less variations that would create potential problems. And again, quality is often enhanced, making it safer. When you have a work culture where people feel free to report problems, don't feel like they're going to be blamed, you're going to learn more about how many healthcare issues you have versus many of them going underreported. Quality measurement and monitoring is everyone's job. So don't be surprised if you're working in healthcare and it's not very long before someone is asking you to take a data collection sheet and go out and collect data. So not only that, when you witness different kinds of risk situations or an event that has occurred, you have an ongoing way of and responsibility, even though you're just the staff nurse, to be able to report that and get that into a reporting system like an RL6 system or even a paper reporting system for incidence reports or quality problems, so that all the data is getting in and getting turned in. So circumstances of quality problems, and you're watching those and monitoring those in an ongoing way all the time. Another key tenet of healthcare quality is you must include your consumers and your stakeholders. So when you're working on these issues that may come up or trying to refine and improve a process or get a good quality outcome, you have to engage your healthcare consumers, being your patients, your family members, and other key stakeholders within departments or job titles or positions within an organization. So you've got the right people who are helping work on these projects. So many of you may work on a project in real life or in practice, in class, where you have to kind of think about who are the stakeholders. And do we have all the departments or the entities here that can give us the whole process when we're talking about it? Or do we just limit it to what nursing knows? Obviously, we have to be open to and seek out those other stakeholders to make sure that we're making the best decisions about how to improve quality. We need to be sure that consensus of all stakeholders is very important. So we don't just go with majority votes when we're working on quality. We really have to have a full agreement of everyone to move forward. And then as health policy is developed, there has to be this idea of we're not just fixing a problem for the moment or writing a policy about something. Our policy should really look at beyond the immediate and how do we really set up something that will be in policy that will be in line with continually trying to improve a process and to have enhanced outcomes. Collaboration is very key. We've talked about that when we talked a little bit about conflict management. But healthcare quality has to have models that are set up that involve the correct interdisciplinary teams and that there is good working relationships within those teams. A code of ethics for nurses makes it very clear that we are to be collaborative partners. And so just as we know that, you also know that sometimes you experience people in the setting that are not collaborative partners. So you want to be able to have as much of that mindset in your organization and an adherence to that to ensure that you're going to have good outcomes. So I'm going to talk about a few of the models that are out there. Schwartz, I think it was around 1980, came out with the Plan, Do, Check, Act model. And this kind of came from some earlier work by Deming, who is a quality guru. And so many of you may have seen some of these kind of actions in other courses before, but when you have a new issue that you want to put a kind of a rapid improvement process in place, you know, your team would sit down, plan the new improvement, do what you're going, implement what you're going to do, study what that result is from that intervention being changed, and then based on those results, make a decision whether further actions are needed or further planning then needs to go into it in a cyclical fashion so that you're ongoingly improving a process. Joseph Juran is one of the founding fathers of some of this quality approach in hospitals and had done work in industry before this. He focused on quality planning, quality control, and quality improvement. Planning meaning that you would be really looking at the whole organization and developing plans so that every department, every area had a specific plan of how they were going to approach quality, what were they going to measure, and how were they going to evaluate it. And then having quality controls put in place, which are more like things, if a problem occurs, you have something to control that never event from not happening, or just that controls are in place so that if some unforeseen quality event occurs, you immediately put a different quality control that's like a stopgap to keep that from happening in the future. And then the idea of quality improvement that we're going to talk more in detail about as we go along. These are just some of the quality planning steps that Juran espoused to. Philip Crosby was another one of the quality gurus. His focus was on having 0 defects. Quality was measured in relationship to conformance to requirements. Results and products are made by people, and systems and consequences of poor quality had to be reviewed. And he was, a big tenet for him was that doing the right thing should be always done to prevent waste. So, so a lot of his philosophies or tenets for his way of doing quality were focused on this ability that we would get 0 defects. And we know in healthcare that that has not always been one of the ones that was as closely adopted by hospitals, because I think globally people felt like, how can we absolutely ensure 0 defects in a hospital when all the human factors and the changes in a patient aren't all under our control? So some agencies do have this as a model. You'll see some of this threaded in their quality plans and organizations, but not all of them, because of that kind of thinking that went around in the 1990s when some of these were getting adopted.